Welcome to a new episode of Science in Context. I'm Sabine, and today I speak with Anna Carnegie and Katharine Sherratt at LSHTM about mathematical modelling for epidemic responses and reflections of UK experiences during the COVID-19 pandemic. Anna, you organised a workshop with leading mathematical modellers from the UK. What was the purpose of getting these people together?
Well, throughout the COVID pandemic, the infectious disease modelling community provided rapid and reliable evidence, which was vital in informing the government policy response. This, though, came at a steep personal and professional cost to those involved in producing this evidence, and responders experienced intense workloads, harassment, exhaustion, compromised career prospects, and in many cases, significant long-term mental health impacts. And we saw this result in staff absences and high turnover, and the question kept being asked, how can the individuals who supported the response be better supported themselves, and what needs to change for next time? So to address some of these questions and provide a dedicated forum for reflection, we came together as a group of 27 individuals who were involved in the UK's modelling response, both to reflect on our experiences and recommend a way forward.
Katharine, what stood out from your findings?
So I think what stood out was the burden on individuals without the institutional support to match. So we saw this in terms of a need for more sustainable work practices, for better health protection, and to ensure that work is appropriately visible as well as rewarded. The UK modelling community is one of the strongest and best placed to inform during emergencies, but this paper still really brings out how we need a more sustainable, a more integrated, and a more transparent approach to integrating scientific evidence into emergency policy response.
Anna, why is understanding this perspective so important?
The experiences shared at the workshop aren't only relevant to COVID, they also impact the ability of modellers to respond safely and effectively to future epidemic outbreaks. And as it stands, the field is likely to repeat similar patterns to those of the past. It's really important that we act outside of response context to mitigate these issues and respond more effectively in the future.
Thank you both so much for your time today.
Thank you.
Thanks.